Welcome to Animal Medical Hospital Training Edition. This presentation is a basic overview including quick tips on how to utilize our ScopioVet microscope. Please sit back and relax as we take you through a short demo for one of our patients. The ScopioVet supports 3 different sample types: blood smears, body fluids, as well as FNAs and impression smears. Depending on the sample type, you will use 3 different sample prep techniques: the wedge push, the slide over slide, or the line roll preparation. Please submit multiple slides. You will need to label all slides in pencil with the patient name, veterinarian, and sample type. Keep your sample in the center and make sure that you utilize a technique that allows even cellular areas. Allow sample to fully dry before starting the diff quick process. After you have completed staining, allow sample to dry completely before gluing the cover slip. This is the frosted area that you will label with a pencil. Make sure that the patient name, veterinarian, and sample type are clearly written. After the sample preparation including staining, it is time we glue on the cover slip. Confirming the sample is completely dry, place a small drop of glue on the center of your slide. Next, gently place the long cover slip over the sample. Please ensure no glue has seeped out the edges. If this does occur, you may wipe it with a lens wipe. Allow up to 5 to 7 minutes for drying time. Go ahead and take out the tray from the microscope. You're going to place the slide cover slip up and the frosted edge on the opposite side of the clip. Please make sure that the slides are secure before replacing the tray back into the microscope. Click on the microscope icon located in the upper left-hand corner of the ScopioVet's case gallery. Click New Scan to generate the images of the slide. Input the correct information under the correlating slide. This slide is a normal scan type. The sample type is fluids direct preparation, as we did not concentrate the sample. The site is mass abdominal. Next, select the areas to be scanned. For blood smears, include the monolayer and feathered edges. For cytology, include cellular areas. The size of the selection will determine the duration of the scanning process. After confirming your selection and clicking Start Scan, you can step back to the microscope and enjoy the light show. Let's go ahead and assign this to a case. Click Review Unassigned Slides. Choose the correct slide and click the folder icon located in the upper right-hand corner. Assign the requesting veterinarian, and next, choose the submitter. The submitter will always be AMH Charlotte. Again, the submitter will always be AMH Charlotte. Finally, include the history of the case. Now complete the patient information. Include the patient's name, the last name of the owner, and the patient ID as it appears in Cornerstone. Choose the correct species, breed, and age. For the age, if the patient is younger than a year old, please select 0 for the year and then enter in the correct amount of months. Select the sex of the patient and then save the patient information. Scroll down to Alerts and confirm that AMH Charlotte has been highlighted. Scroll to Sites and Scan and confirm the attached slides are correct. Add in any additional information you would like the pathologist to read. At this point, you can save or save and upload. If you are prepared to have your case read by a pathologist, please select Save and Upload. Please be aware that our hospital is passcode. What that means is our samples are routed to a particular pathologist. When you upload a case, a pop-up will appear and you will be asked preferred pathologist or first available. You will want to pick preferred. If you pick urgent and the pathologist is not available, it will be routed to the rest of the network. If it is not urgent, the case will remain with your preferred pathologist. You can find the report in multiple locations. It will be emailed to you as well as the treatment email automatically when signed off. You can also click on the Reports tab to access the full report with the option to save as a PDF. Please feel free to chat with your pathologist using the chat box or even ask for a second opinion. You can find the necessary materials and additional resources in the 2 drawers underneath the hardware. In the first drawer, you will locate the glue, the slides, and the cover slips. In the second drawer, you will locate our information notebook. There is a laminated sheet of quick tips on the front cover. The first page gives you troubleshooting resources along with additional training. There's information on slide preparation. The back section is Scopio's training presentation, which gives you an in-depth perspective and additional resources. In the same drawer, you will locate the slide case carrier. This will hold all slides that are sent to the pathologist to be read. And that concludes our presentation. If you have any questions, please do not hesitate to email, Slack, or text me. I appreciate your time and attention. Here's to optimal patient care.